Hello everyone, my name is Belle Waldorf and today I will be presenting my topic on the autoimmune disease called lupus. This campaign is an awareness campaign, and overall a great deal of the general population has little or no knowledge about lupus. Although I would like the population at large to be aware of lupus, this particular campaign will have a greater impression on a specific audience and will therefore have a much larger significant impact as a whole. This campaign could be addressed to those who have lupus already, yet they clearly already know the signs to watch for. With that said, there is a distinct group of people who are at higher risk and should be informed, and this age group is right here on every college campus you step foot on. So let's start with who gets lupus, and who is the most risk for being diagnosed with this incurable disease. 1.5 million Americans reportedly have lupus, so men can get lupus too. Yet 90% of individuals diagnosed are women. This disease is often diagnosed and developed in women between the ages of 15 to 44 years, but this target range, the disease is 2 to 3 times more prevalently diagnosed in women of color. This includes African Americans, Hispanics, Asians, and Native Americans. These statistics are the reason that I've chosen to focus my campaign audience towards college-aged women, and specifically college-aged women of color, since the disease is at highest risk that develop for them. And since this disease can take on the average between 6 to 8 years to be clinically diagnosed, with earlier diagnosis, the management of this disease can help most patients lead a better quality of life. The primary strategy that I will be employing is the use of evidence, and my audience will receive a better understanding through real statistics, facts, signs, and symptoms. This will overall lead the target audience to a better understanding and to be informed, for 16,000 people each year are diagnosed with lupus. So what causes lupus? You can see by this slide that there are 3 known contributors that doctors have so far come up with that can lead to lupus: hormones, genetics, and the environment. I'm not going into detail here since I'm talking about the evidence strategy and not the course of this disease. But these 3 factors are important, and this disease is not contagious, and that is something I would clearly point out to the audience. So the first thing for the audience to be aware of are that there are 2 main types of lupus. The first thing for the audience to see is that the common type developed is called systemic lupus erythematosus, which nearly 70% of patients have. This type is usually what people refer to when talking about lupus, and the word systemic means that the disease can affect many parts of the body, brain, and central nervous system. This type is also likely to cause a type of rash that can develop from high sun exposure and has been nicknamed the butterfly rash, since it depicts that shape in red patches that formulate around the nose and cheeks of the patient, as seen in the pictures here to the left. The other most common type, which affects around 30% of patients, is known as cutaneous lupus, which is a skin disease that creates small sores or lesions around the areas of the skin, such as the face, neck, arms, and legs. Common signs and symptoms to look for that are obviously not external but internal signs include extreme chronic fatigue, sensitivity to sunlight, arthritis and joint pain, mouth sores and tongue sores, blood problems such as anemia, pain in chest when breathing, and low-grade fevers. For my message, I would like to target college-age students across college campuses to spread the word about lupus awareness. A great approach each year is when school begins in the fall and all campuses are hosting their students' activity fairs. Women's groups overall would be a great place for exposure, but my target audience, the Women of Color organization, would be the perfect group to create an alliance with. The messenger for this group in particular can be done through 2 means. One would be to have a brochure to pass out to their members, which is one that I have created here. And another great messenger would be to have fellow students who are lupus patients to come into meetings and be guest speakers to share their personal story. These messengers bring credibility and reality to the serious issue, along with sharing signs and symptoms that others may relate to. Overall, this campaign is important for college-aged women to hear, and once aware of what lupus is, they too can be advocates to help others. This concludes my campaign presentation, and I really appreciate you taking the time to listen. Thank you.